Thank you for coming today, everyone. Alberta's Health Statutes Amendment Act of 2025, which we know as Bill 11, raises serious and immediate concerns about whether the province is moving outside of the national standards set by the Canadian Health Act. Those standards exist for a reason: to ensure that healthcare in Canada remains public, universal, and accessible based on need and not ability to pay. When a province moves beyond the policies in a direction that risks opening the door to privatization, two things are at stake at the same time. First, the integrity of Canada's public healthcare system itself. If we allow provincial legislation to chip away at the core principles of the Canada Health Act without scrutiny, we set a precedent that those principles are optional rather than foundational. Second, the decision that opens parts of our healthcare system to private providers can create long-term consequences that are difficult to reverse. Once market structures are created, it becomes harder, both legally, financially, and politically, to pull back and fully restore the public system Canada relies on. That is exactly why federal oversight exists under the Canada Health Act. The federal government has both the authority and responsibility to act where there are credible concerns that national standards may be undermined. So our call is straightforward. First, the federal government must conduct a formal Canada Health Act compliance review of Alberta's Statutes Amendment Act 2025, number 2. Second, the government of Alberta should be urged to pause implementation of the legislation while its impacts are examined by Health Canada legal experts and independent national specialists. And third, if the review confirms non-compliance, the federal government must be prepared to use a full range of enforcement tools available, including discretionary penalties of withholding Canada Health Transfer funds. The public health care is one that's defending commitments Canadians made to one another. Protecting it requires vigilance, and when necessary, it requires action. This is one of those moments. Thank you very much, and now you're going to hear from Jennifer Benoit, the chair of the Nova Scotia Health Coalition.
Thank you, Jason, and thank you all for being here today. Today, provincial health coalitions across the country are standing up for our public health care. Canadian healthcare system was built on a simple principle. When you need care, you receive it based on your need and not your ability to pay. For generations, Canadians have carried one card in their wallet. That unites us as Canadians, our health card, that guarantees access to doctors, hospitals, and hospitals for everyone. Those cards represent the greatest achievement in our country's history, universal Medicare. Today, the promise is under a direct threat from the Government of Alberta. The legislation entitled the Health Status Amendments Act, Bill 11, as we know it, is not merely a set of administrative tweaks, but a deliberate move to introduce market-driven U.S. healthcare, which fundamentally changes healthcare in Canada by introducing private for-profit insurance for medically necessary care. Let's call this what it is. It's not modernization, as they called it. This is the dismantling of our universal health Medicare. The bottom line is this legislation is the most direct, severe attack on public Medicare in Canada since its inception. The legislation takes us backwards to a time before Medicare existed, when access to doctors and hospitals depended on who could afford it. Once private insurance enters the system for medically necessary care, the principles equal access disappears. The result is simple. Those with money move to the front of the line and everyone else waits longer. The result is we've heard that Alberta government claims that it's just like Europe. That simply isn't true. The United States is home of the most powerful for-profit healthcare corporations in the world. Once the markets open in Canada, those companies will move quickly and they will fight to expand their markets across the country. What starts in Alberta will not stay in Alberta. This legislation directly undermines the universality and accessibility principles of the Canadian Health Act, the law that protects universal health care in Canada. These principles cannot be ignored without consequence. We know exactly what happens in two-tiered health care. Doctors and nurses cannot be in two places at once. When private tier is introduced, it pulls health professionals and resources out of the public system. The result is predictable: longer times in the public system, more pressure, longer wait times in the public system, more pressure on staff, growing inequalities in accessing care. At the same time, private systems privatize profits. That means they will focus on the healthier patients and the simpler procedures, while the public system is left handling the most complex, demanding cases with fewer resources. And let's talk about what that will mean for patients. When someone is sick, in pain, or facing serious diagnostic issues, being asked to pay for faster treatment is not a real choice. If you're told you can wait months or even years in the public system or pay out of pocket for treatment within weeks, that's not a choice, that's coercion. Over time, this creates the exact system Canada has always fought to reject, one where wealth determines access to health care. This is why the moment demands leadership from our federal government. The Canada Health Act exists to protect universal health care across this country. We are calling on our federal health minister, Marjorie Michel, and the federal government to immediately stand up to Alberta to enforce the Canada Health Act and save our public health care. The federal government has the authority to withhold federal transfers from provinces that violate the Canada Health Act. And the federal government should also keep an eye right here in Nova Scotia under what is happening with our Premier, Tim Houston, putting a stop to privatized health care that exists here as well. Like the $18 million this government has spent between last year and this year's budget to privatize mental health and addictions, with publicly paid but privately delivered care. Private diagnostic clinics and private donor clinics that are exploiting people for their plasma, just to name a few. Health care should be provided by public providers and available to all. Canadians deserve to know whether the federal government will stand up for their universal health care. If we don't fight back, we will lose. If we lose, our province and our country will fundamentally be changed for the worse, and millions will suffer. Canadian sovereignty has to mean something. As a country, we decided that health care would belong to the people as a public service, not a private profit. We would take care of each other through our public-funded health care and not suffer financial ruins when we are sick, elderly, dying, or least able to pay. Those values of compassion, equity, taking care of one another, of caring for people, not for profits, are deeply held. Canadians fought for universal Medicare. Generations have defended it. The question is whether the government will do the same for us. In final, we are asking all Nova Scotians to call on the Liberal Ministers of Parliament across our province at 1 p.m. today and encourage the enforcement of our Canada Health Act. You can find all the details on our website at novascotiahealthcoalition.ca. Now I'm going to call upon Melissa Marsman, the Nova Scotia Federation of Labour President, to say a few words. Thank you.
Good morning, everyone. I'm Melissa Marsman, President of the Nova Scotia Federation of Labour, representing 350 unions with 70,000 workers. The Federation is proud to support the Nova Scotia Health Coalition's Day of Action for Public Health Care. Today's action is part of a national movement to protect public health care in Canada. It is spurred on by Danielle Smith and the Government of Alberta's Health Status Amendment Act. This is a law that allows doctors to charge patients out of pocket for the care they should be receiving for free. But in Nova Scotia, private health care isn't a problem far from home. It's something happening right here, right now. Workers have sounded the alarm as private clinics have started providing mental health care, plasma collections, contracted surgery, and primary care. Private providers take resources away from our public systems and make it harder for Nova Scotians to access service. Workers are calling on both levels of government to enforce the Health Act, reverse the trend towards private care, and to properly fund our health care system. Healthcare workers are heroes for their advocacy work on behalf of patients, but if government stepped up and did their job, they could focus all their energy on their main passion, which is healing Nova Scotians. Thank you again to the Nova Scotia Health Coalition for hosting today's event.